Welcome to Phase 3, Stage 2, Communicate a Treatment Plan. Defining the OT value proposition. Let's delve into the art of conveying our expertise to patients without losing its essence in translation. As dedicated occupational therapy practitioners, we understand the significance of activity analysis. It sets us apart from others and truly embodies the value proposition of the profession. Here you have a little illustration where it says false. I explain my treatment plan, but they don't always understand anyways. True. Communicate your treatment plan so that your expertise is not lost in translation. Communicating your value and communicating your knowledge and communicating exactly what you're going to be doing with your client to your client so that they understand is extremely important. Our main value proposition as occupational therapy practitioners, in my opinion, is activity analysis. We are activity analysts, and I want to equip you with an illustration necessary to really drive home what it is you do and how you are going to help the patient that sits across from you. So here's a common scenario, the patient handoff. You will find yourself stepping into a patient's plan of care unexpectedly, collaborating with colleagues, and receiving patient handoffs. Your schedule is not under your control, and ideal one-on-one patient care is not possible. So it kind of feels like, man, I feel like I'm going to be set up to fail once I become a clinician, or if you're already a clinician, you're like, yeah, that does happen. You walk into other people's plan of care all of the time. You are given patients that you don't know. You're told to do discharges from 4 people you've never met. That is what happens, and that's just reality. So what can you do about it? There's not a lot you can do to change that it happens, but there is something that you can do to kind of pick up the pieces and run with it. So the solution is to align or realign your focus and set your intentions. Okay, so what does realign your focus and set your intentions mean, or what's involved in that? Review your patient's initial evaluation and focus on their goals. So look at your patient's background, right? All of that good stuff. But then head to the goals. That's the good stuff. That's where you're going to hang out. That's what you're going to do when you walk in and see that patient for the first time. How will you effectively break the goals down and communicate them to the patient to ensure maximum engagement? How do you increase their confidence that you understand their needs? Empower them with knowledge and communicate your process. Whenever I walk into another person's plan of care, or I'm taking over care, or I am headed in to complete a discharge of a patient that I just met, I'm going to introduce them. I'm going to explain what I know about them. I'm going to tell them the goals they've been working on and where the chart says their status is. So what is my point of view regarding their status? And then, if possible, I'm going to say, does that sound accurate? Is that where you believe you are? I want to engage, and I want that engagement to be around the goals that they've been working towards. Okay, so once you know your goals, and once you know the goals that you'll be working on, and you've spoken about that to your client, now it's time to actually design a treatment plan continuum for those goals. I do have a couple of resources for you, along with, actually, I think I included maybe 3 or 4 other ones about building a treatment plan. Here you have a treatment plan and communication sheet and your activity analysis illustration. So how do you turn your goals into treatments using interventions? I wanted to delineate there between intervention or treatments and interventions. You have a treatment plan continuum. So the treatment is that, 30 to 75-minute window where you're performing interventions. So there is a difference there. They are not synonymous. So how do you do that? First, you consider the diagnosis. You must know the mechanism of injury or impairment in order to understand the mechanism of healing or remediation. This is important. If you do research, if you look at the research, if you read it, you'll see that the mechanism of action for the diagnosis, it changes how the body will respond to certain interventions. So if the condition is one thing, so say your patient comes in with, say they come in with a broken hip, okay? They broke their hip, they fractured their hip, and they had to have it, they had to have it fixated, and now they're in rehab. They have to strengthen their core, they have to strengthen their back, they have to strengthen their legs, they have to manage their pain, manage their medication, and really understand what all has happened, because of this hip fracture. If they also have a movement disorder like Parkinson's, and they're unable to walk as they did because of the break, that's going to change the way you do rehab. So although they go in, they come to you for generalized weakness associated with their hip fracture, you have to know how the Parkinsonisms will impact the recovery of that hip. Okay? If you have any questions on that, please do not hesitate to ask. Current objective status. Where are they in their current plan of care? Review one goal. Bonus if you are the one who is writing the goal, because you are writing the goal to fit your treatment approach. What do I mean by review one goal? Well, remember that with this sheet, you're planning a treatment, and you're planning to communicate your treatment rationale to your patient. You do not need to work on all 3 goals in your plan of care at the same time, though every single one of your sessions should attach to one of the goals that have been mentioned in your original plan of care. You don't want to go rogue. Don't be an adventurer. Stick to the plan. If the plan changes, then update your plan of care. You have to remain consistent and structured, or you won't ever get anything done. There will not be any progress made if you go rogue every session and never work towards the completion of a single goal. Consider the activity analysis of that goal. Until you feel stronger in the ability to analyze on the fly, use this activity analysis sheet to break down the goal into its components and critically analyze how your patient's current impairments and presentation will pose a barrier to the elements in your analysis. If there is a disruption at the body function level, you must address this in order for the occupation to be achievable, most times. This is why we work in continuums according to our analysis. Take time to perform your analysis based on the information you know about the client. It is so important for you to really, truly take time to conceptualize and understand your patient from the body function level up until their occupational performance level. It's only then when you are able to truly pinpoint the root of dysfunction related to occupational performance, and thereby allowing you to either advocate for them or design a treatment plan around that. So this is very important. It's very important to do your activity analysis. Design your intervention or interventions in order to give your patient a choice. Remember that when you are giving a patient a choice, it's not a free-for-all. You must control the why of the activity, but your patient can control how it is executed. This is true clinical collaboration. When you have determined what part of the patient's continuum of occupation must be addressed, then and only then will you decide what type of intervention you will do to address the most appropriate function, structure, skill, or combination of all of these, which is an activity. So that was a lot, and I understand that. But really, what it's saying is you're not going to walk into your patient's room, or if your patient comes to you in an outpatient clinic, you're not going to say, okay, so what do you want to do today? That I've seen the fallout of that 4 times in my career. And all 4 times it was the patient disengaging from therapies because they felt like the occupational therapy practitioner was incompetent and didn't know what they were doing, so they were just going to let them guide their session. They did not feel safe, they did not feel supported, and this was not just one person. These were many people doing this with all different types of patients, all of them feeling that exact same way. So I do give you a word of caution when it comes to the free-for-all approach. You can give them a choice, and that's important, and that choice is derived from your activity analysis saying, okay, well, today we're going to work on body functions in terms of balance. So we're going to work on proprioception specifically, and being able to write against gravity, or you're going to be able to work on anticipatory postural reactions, I think, right? Or versus actually doing the occupation where you're at the activity or occupation level. There is a full course on activity analysis by way of the Foundations of Clinical Practice, of OT and Clinical Practice course that is on Thrive. So if you would like to learn more about this sheet, please do check out that course. There is also another video. There is the first version of Phase 3, Stage 2 is posted in a separate module in this course. This gives you instructions to get there, or you can look right under this video and there should be a link bringing you to the original video. If you scroll till about 15 minutes in, you're going to have a different explanation of the activity analysis illustration as well as the toileting example. I would encourage you to listen to that because I walk you through exactly how I would explain it. And for me, listening to it again, it is helpful for me. So I would encourage you to take the time to watch it if you feel like you need just a little bit more guidance there. Explaining activity analysis. How does using a visual and illustration help to explain activity analysis? It increases health literacy. It improves internal locus of control. It subtly advocates for the distinctive value of occupational therapy, and it helps explain the complexities of activity analysis. By using an illustration like the one that's included in this module, it's going to be able to make it come to life for the client. That's why we've started using these illustrations in our day-to-day practice at Buffalo Occupational Therapy so that our patients can understand what we bring to the table in terms of value. So do keep that in mind. There is additional training. There is an additional training video. All right, third challenge. If you have not completed the second challenge on case studies, please do that before you do this challenge. If you know you're not going to complete the second challenge or any of the challenges previously, don't allow that to keep you from participating now. So you're welcome to jump in at any time. You do not have to complete the challenges in order, though it is recommended. 3A, deliver your treatment explanation using the activity analysis illustration. Set a timer for a maximum of 2 minutes to clearly and concisely communicate your intervention through activity analysis so that the group can envision a clear picture of your patient. Use your phone or other recording device to capture your delivery of a treatment plan following the template given. This can be your own intervention, your own goal, your own treatment approach, or a new idea you designed when using one of our practice case studies. The more you upload and practice, the easier it will become. Provide feedback to a fellow group member. Provide encouraging feedback for your fellow group members. Go to the circle in the community hub and comment on videos that may be posted or text messages. Listen to them thoroughly and be inspired as you prepare to do your own videos for practice. As always, it's important to step outside of your comfort zone, so please do take the time to engage. That is the most valuable part of this experience. See you in stage 3.